The one study that's quoted very often is 150 minutes of exercise, of cardiovascular exercise, moderate intensity. When you look at the improvement in erectile function scores, it is the same amount of improvement as you would see when you take a medication like Viagra. So literally, if you do 150 minutes a week, you are getting the same improvement as you could get with a medication, potentially. And so I tell people, like, look, if you don't want to take a pill, this is a great way to improve sexual function. Now, you might say, okay, well, maybe you're listening and you have heart issues and you can't really do moderate intensity exercise. They actually looked at that too. So there was a group where they looked at men who had heart disease, and they weren't really able to do moderate intensity exercise. So they did like a 5-minute warm-up, they did 20 minutes of walking and 5 minutes of a cool down. And with this supervised protocol, they still improved erectile function by 70%. So it's all relative to where you're starting, but any sort of cardiovascular exercise that's above what you are capable, like what you're doing now, is going to improve sexual function, particularly erectile function, because it's going to improve blood flow to the genitals. It's going to improve blood flow to the penis. It's going to improve blood flow to the clitoris for women. So that's where cardiovascular exercise is so, so important. In terms of resistance exercise, now these little weights are probably not sufficient for doing much, especially for men, in terms of improving muscular health. But obviously, we're not going to bring like really heavy weights to the table here. So one, we know that resistance training is significantly correlated with testosterone.